Hello, and welcome to the Things I Want My Daughters to Know podcast, the podcast redefining women's health one unfiltered conversation at a time. I'm your host, Jacqueline Rose, and every week I'll sit down with leading women's health experts and real women to share their lived experiences, bust health myths, challenge outdated and uninformed narratives, and explore what's really possible for women. We'll talk about periods, fertility, menopause, hormones, aging, and everything in between. This podcast is for every woman who ever felt confused, dismissed, or left out of the conversation about her own health. It is a space to celebrate women, break the silence, and open up conversations between mothers, daughters, sisters, and friends. Please hit the follow or subscribe button so you don't miss an episode, and share this podcast with your daughters, family, and friends. Let's get on with the episode. Hello, everybody, and welcome back to another episode of Things I Want My Daughters to Know podcast. And I am very excited for today's conversation. I think I say that with every guest, but today we are really going to be talking about a topic that so many women, I think, are impacted by, but so few women actually know what it is and what is going on and what is happening in their bodies. So, Claudia, welcome. I am so happy to have you here with us. Tell us who you are. Tell us a bit about what you do. And we're going to get into this conversation around the topic of PMDD. If you don't know what that is, if you've maybe heard of it, this is what we're going to be talking about today. And I think we're going to really be uncovering a lot of things that women are probably experiencing but don't even realize it. So, Claudia, welcome. Tell us a little bit about who you are, what you do.
Thank you so much for having me. I'm Claudia, and I help overwhelmed moms, especially those who are dealing with hormonal struggles like I do with PMDD, to find more joy and balance in their motherhood by integrating more self-care in their daily lives, because this can be really hard.
Yeah. So we've used this phrase PMDD. Let's unpack it a little bit. Let's say what it is, how it shows up, maybe even why it happens, and possibly, and I think this is going to be really important, some women listening either may start to identify this either in themselves or in their daughters, and maybe they never even realized this was a real thing. So let's unpack firstly what this PMDD is, how it shows up, why it happens.
Okay, so PMDD stands for Premenstrual Dysphoric Disorder. It's often described as the big bad sister of PMS, which I think most people have heard of. Yeah. But if we break down the four words, premenstrual means it starts before your cycle, right? Before your period. Dysphoric is a feeling of intense sadness, grief, being depressed. And disorder means you're not functioning as you should. It's an abnormality. This is how I always explain it. It's an abnormal feeling, negative feeling in your life.
Okay. And how does it differ to that standard PMS? Why does it have its own definition?
So PMS is often physical discomfort. A lot of women also experience some moments of being down, of being sad, but that's often restricted to 2 or 3 days before your period comes on. With PMDD, that period can be much longer. So it can start at ovulation. And then in the worst case, you have 2 weeks of feeling depressed, of feeling anger, of feeling anxiety. Yeah. This is also a thing why it doesn't show up or why women don't recognize it. The symptoms vary so much. Like there's 12 recorded symptoms. There's 4 core emotional symptoms, and they cover depression, anxiety, and anger. So if you don't have all 3 of them, or if I tell you that I was so depressed I wanted to drive my car against a tree, trigger warning, and you don't recognize this because you get very anxious before your cycle, you would never think from my story that you could have PMDD too.
Yeah. And I think that so often we know PMS and we understand PMS more or less. It's sort of very, common. Doctors understand what PMS is, women themselves, there's some very typical, standard ways that it can show up. I think one of the challenges with PMDD is that often it's misunderstood as maybe being covered up or being categorized as generic or general anxiety and depression. And I think what makes PMDD different, and I really want you to talk about this, is the hormonal cyclical relationship of this. So you also may have generalized or be diagnosed with generalized anxiety, depression, you know, all the things that are contained in that diagnosis. Yeah. What makes, from my understanding, and please share with us your thoughts on this, that PMDD is much more cyclical. It's much more related to hormones. And that's why sometimes, because women's health is not well understood, because our hormonal cycle is not well understood, it's not really diagnosed in that way, because they're just generalizing it as, well, you have generalized anxiety and depression.
Yeah, so PMDD is very often misdiagnosed, most commonly misdiagnosed as bipolar, because bipolar is also an up and down, but not in the same pattern as PMDD. PMDD can, without fault, be linked to your menstrual cycle. Symptoms will come on sometime around your ovulation. Yeah. They might go away for a little bit, which might be confusing, and then they come back 7 to 10 days before your period. Yeah. And they subside as soon as your menstruation comes on, or maybe a few days in, but they go away. And what most women describe is that they are two completely different people. So in their, what I call the good weeks, in the follicular phase, they're happy, they're outgoing, they're not stressed that easily, noise doesn't bother them. And then come the PMDD weeks, all that changes. Like I would like yell at the cat when the cat would walk in front of my feet while I was walking down the stairs. And it's like, who in their right mind would be bothered by that? Yeah. But it's just, my brain doesn't know how else to respond to that.
Yeah. And I think it can be really severe. It can show up very legitimately, because that is some of the, the classifications of PMDD as severe anxiety, severe depression, severe, very dark thoughts, the anger, the mood swings, the inability to self-regulate. And then I understand why so many people would diagnose it as bipolar, because there are a couple of weeks of the month where you are, your normal self, and then all of a sudden you're a different person.
Yeah. So, I understand why it's misdiagnosed. I understand that it's also complex, right? There's 12 symptoms, and the thing with PMDD is you can have it next to a pre-existing disorder. Like you could have anxiety all your life, but you could have the depressive symptoms of PMDD only in your cycle. This is what we call PME, but this is a whole nother horse. That is like, there's no research, or there's almost no research on that. But it's so complex.
Yeah. So tell us then, sort of the hormonal piece, our menstrual cycle tracking, all these types of things. Sort of share with us, like, you said there are 12 symptoms, but let's say someone realizes through listening to us that maybe, oh my gosh, those I'm expressing as if I have anxiety or depression, which, very real, very debilitating, very impactful to someone's life. But all of a sudden they're realizing maybe they never paid attention to this, but actually they're beginning to realize maybe it's a bit more cyclical than they experience. I definitely know that someone who has anxiety and depression, they perceive their experience as being 24/7. But when you take a minute to stop and you actually take a step back, all of a sudden you may realize it's a little bit cyclical. So talk to us about sort of how we identify PMDD versus generalized anxiety or depression.
So I think I can tell you how I figured it out, because I had a postpartum depression when my son was born. And I was being treated really quickly. Like I had the help I needed coming in right away. even when I was still at home, like 2-3 weeks after the birth. And then, the kid gets older, the postnatal depression is being treated. We were turning from fall to winter to summer, and in summer I perk up again. So I was getting better. Yay. But from time to time, I still had these feelings like I was a bad mom. I had this little kid and I didn't want to go out with him because it felt overwhelming. I would stand in his room crying because I had to get him dressed and I didn't think I had the energy.
Yeah.
So these were really bad days where I just felt like I was failing.
Yeah.
And then one month I thought like, oh wait, next week my period is coming on. And I would go about my life. And then a month later, I had a similar situation where I would start crying again.
Yeah.
And I thought like, hey, next week my period is coming on. And this went on for like 3 to 4 months until I realized like I had this exact thought last month. So it took me a while to recognize the pattern. And then I started Googling like, can you have cyclical depression? And that's when Google came up with PMDD. So I think first and foremost, it's about noticing your own patterns. That can happen through a diary, that can happen through like logging your moods in a mood app. That's the first thing that needs to happen.
Yeah. Is tracking, being, and just observing your own.
It's not putting labels on it. It's not putting, and so I've been tracking my cycles since I was a little girl. I used to have like calendars, and then when I didn't want to take the pill anymore as a student, I switched over to NFP methods, so with the temperature and stuff. So I know my body and my cycle very well. It's something I would tell everyone to do. It's great knowledge to have about your body. It sounds daunting at first, like you have to work with a thermometer and stuff, but it's not really. And that knowledge, at some point, I was like, okay, I can track when I'm ovulating, or when I have ovulated. I can track the phases of my cycle. I know exactly where I am. And that knowledge relating to like my mood swings was really, really valuable because it was also proof for my doctor to be like, this is very clear and very obvious.
Yeah. So a couple of things I want to ask you. First, you mentioned the issue of your doctor, and we're going to get back to that. But I want to ask you, for someone who maybe you obviously are naturally cycling, you're having a regular period, and therefore you can track clearly and monitor and observe. What about someone who is maybe on the oral contraceptive pill? It's, they may say, well, I'm not having necessarily a bleed, or maybe I am having a bleed, but we know that the bleed from a pill is not it's more of a synthetic bleed. Yeah. Can someone who's on the pill also experience PMDD? And how is that going to show up? How are they going to be able to monitor that? Can they even monitor that? Like, is that sort of, how does that work?
Okay. Before I get to answer that, I think we have to quickly say what PMDD is in your brain, because a lot of people think that PMDD is a hormonal imbalance, which it isn't. So PMDD is a reaction of your brain to the natural fluctuations. So you can have perfectly normal hormone levels, and every woman experiences the up and downs of her hormones throughout the cycle.
Yeah.
Just women with PMDD react badly to it.
Interesting. So it's not a hormonal imbalance. It's a brain response to your hormones.
That is the current theory. Yeah.
Excellent. Which for me, as you're talking as a menopause specialist, is really getting me thinking about how our brain function and cognitive function changes as we navigate those fluctuating hormones in perimenopause and menopause. And I think that relationship between brain and hormones, that our hormones and brain are actually talking to each other, is really, really important to know. And that it's not just in perimenopause and menopause, it's throughout our whole life cycle as ovulating, hormonal, reproductive beings.
Yeah. So getting back to the question, if women who take the pill can experience PMDD, in theory, the pill should make it better because it levels out those hormone fluctuations, right? There's no.
Right.
So taking the pill is also one of the first line treatments for PMDD because, well, if you suppress ovulation, you suppress the up and downs of your hormones.
Yeah.
However, we see that there are so many women who don't get a positive effect from the pill because next to the theory of the brain reaction to the hormone fluctuations, there's also the theory that women with PMDD have a bad reaction to progesterone, or actually a pre-stage of that. Yeah. But and especially to the synthetic progesterone that is in the pill. So we see that women who take the pill, and I had that exact same example. I obviously tried the pill because my doctor wanted me to. I turned into a witch full time, according to my husband, and I didn't notice. So I had the PMDD symptoms no more cyclical. I had them the whole month for the 3 months that they asked me to try the pill. Yeah. I was being mean. I was being easily annoyed. I was frustrated. I wanted to break up the family multiple times. Yeah. It was not fun.
Yeah. So I think it's really important to dive a bit deeper into this, and I also have personal experience of this within sort of my family also, that one of the treatments for PMDD is giving the pill. And what I need to say here is not all pills are the same. The oral contraceptive pill, there are different types of oral contraceptive pills. They have different hormones over the course of the month that you take the pill. Some oral contraceptive pills have the same hormone dosage in every pill. Some oral contraceptive pills have fluctuating hormonal dosages to replicate more the natural menstrual cycle. But yes, for some women, the pill can really be a saving grace in PMDD treatment. For some women, it can absolutely, as you described, totally exacerbate it and make it even worse, which is very, very scary. And we also have to remember that the oral contraceptive pill is synthetic hormones. So you may be responding to some type of the synthetic hormones that are in the oral contraceptive pill. And fascinating that you say, and I just want to go back to this, that a lot of PMDD sufferers are actually progesterone sensitive.
Yeah.
Because we know that progesterone is that mood hormone. It is the hormone that, as it drops toward, if you do not get pregnant and in your regular menstrual cycle, it falls towards your bleed. That's why we experience PMS, because that progesterone is a mood stabilizer. Yeah. So interesting that you say that despite that sort of natural, normal feature of progesterone, that for some women, they are progesterone sensitive and therefore are not going to respond in the way that you would expect.
Yeah, so it's normally said to be calming, right? That's why we tend to focus inwards before our period. And apparently with a PMDD brain, it has the opposite effect.
Really, really interesting. Really interesting. Okay, you talked about doctors and that doctors will, the first line of treatment is to prescribe the pill. Talk to me about the medical field's understanding of PMDD. We know that women's health is very misunderstood, very not, so many doctors are not educated in so many of the women's health issues. We know that endometriosis, for example, it can take anywhere from 5 to 11 years to be diagnosed with endometriosis. So talk to me about how PMDD is understood and how doctors, your experience and your clients' experience of doctors' support or otherwise.
Yeah, so I think for PMDD, it takes about 12 years to get the correct diagnosis. And you see an average of 6 practitioners before you find the one that will diagnose you. With PMDD, I see a lot of finger pointing, like The general practitioners are not too keen on diagnosing it. The gynecologist will point you to the psychologist or the psychiatrist, and they will point the finger, vice versa. Because the symptoms are mostly mood symptoms, right? So it has to be in your brain. It has to be the psychologist who has to help you. But the root is in your reproductive hormones. Not all gynecologists, like I've even seen countries where an endocrinologist gets involved because they are the hormone experts. And I think it really depends on who you meet as a practitioner. I have a doctor who was very open, who said, I don't know much about it, so I will call a gynecologist to educate myself and I will get back to you, which is not the story I hear.
It's a real unicorn doctor, those doctors. They do exist. And, you know, we should all have the benefit of those doctors, but they are real unicorns.
Yeah. And so I think the first thing you need to know is you need to advocate for yourself. I think in all of women's health, whether it is PMDD, whether it is getting the right treatment for menopause, you have to advocate for yourself, and that itself can be very tiring. And I always, like, what worked for me was to deal with the facts and to go to my doctor with the facts. So I was armed with brochures. I was armed with pamphlets. Like, these are the simple facts. This is the research behind it. This is my cycle, black and white. You can see menstruation, this mood, ovulation, this mood. And they were like, okay. So yeah, it helps that PMDD is classified in the standard doctor's manual, so the DSM-5, which psychologists use, but it's also in the ICD, the International Classification of Diseases. So general practitioners should be able to find it. They should know about it. And it does say that it's a hormone-based mood disorder. So it's not only anymore a mental health thing, which I think is a big step forward, because how many times are we being told it's just in our brains, it's just in our head,
heads. And this is classic. This is a classic example of doctors being able to legitimately say, if it's a mood disorder, it's just in your head, go see a psychologist or a psychiatrist. This has nothing to do with me.
Yeah. And which is so weird, because I think by now we should know that how big a role hormones play, right? Yeah. But again, I have the idea that because for men it works different, right? Men have cycles too. They just don't have a monthly cycle. So, and if they would experience what we experienced, would it be better researched? I think it would be.
Of course, we know that. We know that women's health issues are, direly under-resourced, underfunded, under-researched. So it's quite shocking, and it's understandable why women suffer in silence, don't want to go to their doctor, don't want to explore treatment options or solutions, because if you're going to see 6 different specialists and everyone is saying to you, this is just in your head, this isn't real, or go on antidepressants or a more of a psychological response to, or psychiatric response to this, you would understand why women don't want to go see doctors for these types of situations.
Yeah, and in the worst case, you get a label that doesn't fit, but it's from now on in your medical file. So the next practitioner you see will see that label and doesn't look any further than that, because you already have a label. So I can understand why it takes so many people and 12 years, because that first misdiagnosis will follow you around.
Yeah. So you work specifically with mums, but I'm assuming that PMDD doesn't just happen all of a sudden.
No.
With the women that you work with, is there a retrospective look back on, like, oh my goodness, I have had this for years, and all those, my teen years, all those experiences can now be reflected back with the language of PMDD? How are you seeing that happen?
I see that happen for a lot of women. Like, PMDD can come on with every big hormonal shift in a woman's life. That can be the onset of menstruation, that could be a miscarriage, that could be even taking the pill and coming off the pill.
Yeah.
So some women, when they hear about PMDD, everything about their life falls into place. They realize maybe the big hormonal swings they had as a teenager were already PMDD.
PMDD.
We do also see, but this is, I think, a smaller percentage of women who gave birth or had a miscarriage, and then and all of a sudden my cycle feels weird and I have symptoms I never experienced before. So it can go both ways, but I think the ones we hear most often are the ones for whom it falls into place, like I've had this all my life.
Yeah. I want to talk to you about treatment options and what hope there is for women moving forward with PMDD. But before I talk about that, I do want to talk, because we are talking about that this is a mood disorder based in hormonal fluctuations, and that this is the relationship between hormones and our brain. Does psychology, psychiatry, pharmaceutical, antidepressants, anti-anxiety, does that play a role in this conversation?
It does, definitely. There are several ways or routes of treating PMDD. They all have their merit. Different things work for different people. And unfortunately, it's trial and error for most of us, which can be really scary. I've done it all, so I can talk about all of it.
So let's go into it then. Let's talk about, because it can be very scary for women. I know that it can be excruciatingly scary for the women, for their loved ones, for their families, because you can end up in such a dark place during that time. So what are the options? Where is the light at the end of the tunnel for women who are experiencing this?
Okay, let's maybe go from easy to very severe interventions. Like the easiest would be changing your lifestyle.
That's the easy one.
Well, the least medical one. Let's put it that way.
Great.
The least medical one.
Okay.
It's not easy, obviously. And that depends on what you subscribe to. I don't subscribe to a lot of supplements or taking a lot of supplements because research on that is lacking in quality research mostly. But there are women who find relief from a gluten-free diet, a sugar-free diet, no caffeine. I think this is very personal. This is something you should talk about to a nutritionist. I know that nutrition plays a big role in like menopause. So I think, I believe it helps to feel better in your body, to be more healthy, to be more resistant, to have a better immune response. I don't think it takes away the PMDD.
So it's really interesting you say that. We know that gut health, your gut microbiome is so critical to a lot of these conditions, a lot of these chronic conditions, and triggers or things that really disrupt the gut microbiome that are going to then trigger inflammation, that are going to trigger more insulin resistance or any of those autoimmune responses. So removing those triggers like, gluten, sugar, caffeine, alcohol, dairy, whatever your triggers are that are really creating that imbalance. We know that there is a very strong relationship between our hormones and our gut health. We know there is a very strong relationship between our gut and our brain. So any imbalance in the gut is going to sort of impact that triangle of hormones, gut, brain relationship. So as you said, it may not cure you, but it definitely is going to be more supportive.
And that is very personal as well, right? What will help? Like for some, it will be the insulin. For the others, it will be the sugar or So there is no way anyone can make a general recommendation. I think you really have to figure out for yourself what's helping you in that regard.
Okay, so you've got some lifestyle changes, nutrition.
I can't hear you anymore. Wait a second.
So we have these lifestyle nutrition changes. What else are you looking at? What other factors can play a role here?
So then you would maybe go down the psychological intervention route because you have all these mood symptoms, the psychiatric response. The first thing that was suggested to me was daylight therapy.
Daylight therapy.
Yes, so you sit in front of this big daylight lamp, right, for half an hour every morning. Because the theory is it works like an antidepressant. It will give your brain more serotonin to work with.
Right.
I started this in November, which was perfect for me. My winter depression that year was gone.
Right. Oh, wow.
It really did wonders, but it did nothing for like my cyclical depression. So
it helped you with your winter, with your what we
yeah,
call sad seasonal
seasonal
the seasonal
affective disorder.
affective disorder, but it didn't help with your PMDD.
No, but it was a great thing to discover because now I have a lamp and I use it in the winter whenever I need to.
Right.
Like I've also been taught how to use it. This is one thing you should know about like daylight therapy. If you do it wrong, it can actually impact your sleep patterns and make it worse. So you should learn it from someone who knows what they're talking about.
Would you have the same effect of just going out into, into nature, into the sun, sort of being outdoors at certain times of the day, or does it have to be a specific daylight lamp?
I think it really depends on your lifestyle and where you live. The Netherlands in winter doesn't provide enough
Sunlight, yes.
for this effect to happen.
Yes.
And I think if you're already, for instance, because daylight lamp therapy is also used in depression treatment.
Yes.
And I think it's just a really fast way of providing the hormones that your brain needs, like the serotonin.
Amazing.
Which is a neurotransmitter.
Yeah.
And I think generally being outside every day for like half an hour, especially in morning sunlight, is great if you can integrate that into your daily life. It's one of those factors that will make you feel more well overall.
Yeah. But really interesting. And I think this really is strengthening your sort of theory around the fact that PMDD is a hormone brain disorder connected to our reproductive hormones, whereas, the sunlight therapy helped you with your regular depression, but did not help with the PMDD. These are two different things that are merged and interconnected and interrelated, but probably also that, very misunderstood, that they are two separate conditions.
And they might be related. And it turns out that people with PMDD, like our brains seem to be sensitive. So there are correlations with other things. They tend to have seasonal affective disorder more often, or ADHD. So basically that didn't work for me, and I decided to try the antidepressants because they're supposed to have the same effect. And they work surprisingly well. Like the theory is that your brain needs a little bit more serotonin because that in turn influences the neurotransmitter allopregnanolone, allo in short, which is the one you need for the progesterone. And there's new research that it helps, even taking it cyclical, or I've seen research from Germany where women take it only when symptoms set on in their cycle.
You're talking about antidepressant medication.
Antidepressants, and
not to take it every day.
No, but just take when symptoms set on until their period starts, because your brain just needs that little bit of extra serotonin. And for some, this works. And this is so contrary to what we hear about general depression treatment, right? And like, not all doctors know about this. Some doctors will tell you need to build up this level of antidepressants. And for PMDD, this can work differently. And I've taken antidepressants for about 2.5 years, and it made a big difference. The only thing I had was I was constantly fatigued, like bone tired. That I didn't want to move. And then somebody said to me, well, then your treatment isn't quite working, right? Because your quality of life is not yet what you want. And I was like, oh, and I thought this was the best I could reach. But then somebody encouraged me to look further.
So I know that there, again, just like with everything we're talking about when it comes to antidepressant, anti-anxiety medication, when we're talking about a psychiatric diagnosis, you have to make sure you are with, you're not taking your own meds, you're not self-dosing, you have to be in proper care.
Yeah.
And again, not all pharmaceutical antidepressants are created equally. Different people respond to different types of medications. As we've said, it can take a while to find the right combination for you, the right dosage for you. Some medications really can exhaust you, and then you need to, find the one that works for you. Sometimes, reducing a dosage or increasing a dosage can make a massive difference. But and as we've said, sometimes and often PMDD comes together with generalized depression.
Yeah.
So you're going to have to, it's possible that the cyclical taking of antidepressants may work for some people, but if you have also generalized depression, then you may need the consistent pharmaceutical dosage. So it's complicated. And I think, as you've said, like as you have repeatedly said, it takes time and women get exhausted. They are already exhausted and suffering. And then it takes a long time to figure out the right solutions, which is also exhausting. And, they're still suffering.
We shouldn't underestimate how scary it is to change something in your treatment.
Yes.
Like, I didn't think I would have that. I'm fairly rational.
Yes.
But I have noticed now that whenever I need to change my treatment for whatever reason, I'm worried it might get worse again. I'm worried because I know how bad it can be when it's not working, right? I know the deep, dark, depressive thoughts. And it's tiring, it's excruciating. And everything you try, you should try for a minimum of 3 months. So finding something will take you at least 3 months, maybe a year.
Yeah.
And you never know how long it's going to help you. This is another thing with PMDD. Even when you're diagnosed, even if you're in treatment, it's something that you'll have your entire life, at least your entire menstruating life. And for some, it doesn't get better after menopause. And this is something we have to learn to deal with. And I have not found an answer to that because we don't have those handy classes that cancer patients get, how to live with cancer. There is no how to live with PMDD.
Yeah. Just like there's no how to live with endometriosis. I know they are two very, very different conditions. They are very different conditions, but I think for the woman's lived experience, there is a lot of similarities between endometriosis and PMDD.
Absolutely.
Yeah. So we've talked about nutritional changes. We've talked about oral contraceptive pill. We've talked about pharmaceutical, antidepressant, psychiatric, psychological support. What is there anything else available? What else can you are you doing with your clients, and what other things are available?
So I don't do any medical treatment with my clients. I refer them to a doctor because I'm not a doctor. But what else is, you treat hormones with hormones is what my doctor said to me. And when the pill doesn't work, you can try bioidentical hormones.
Yeah.
So there are bioidentical forms of estrogen and progesterone that you can take. The experiences vary with how much it helps. And most often we see them used in combination with chemically induced menopause or as a last resort, surgical menopause. Because again, the theory is if you don't have a cycle anymore, if your natural hormones are not fluctuating, you should not have that severe a reaction, but you need the hormone add back because menopause does things to your body, and we actually need our hormones to function and be healthy.
Yeah. Getting rid of it isn't necessarily a good long-term solution. 1 second. So tell me then, Claudia, how do you work with your clients? What is the support, with our understanding that it's a lot of trial and error, with our understanding that there is little understanding in the medical sphere. There are very few accepted protocols. It's, a lot of, women doing their own research, trying to figure it out, what's working for them. So what is your work and how do you support your clients?
So what I have figured out is that women don't have to have PMDD to be affected by their hormones. It doesn't have to be as severe as my experience, but you will see effects of that in your daily life, in your monthly cycle. And a lot of women aren't actually aware of it. This is the first thing when I talk to someone, a mom, a woman, and like they tell me about mood swings and how exhausting it is. I ask them how much they know about their cycle, if they're tracking it, and to just spread this awareness. Because I love my cycle. Like I have very complicated feelings about not having one at the moment.
Yeah.
And I used to track it with all the possible things. And I tell them to do that. And what I do for the moms that I work with, I like to call myself the professional friend, because sometimes you just need someone who listens to you, who maybe has been in that exact same position, because not for everything you need a medical treatment, or sometimes your medical treatment has a wait list of 3 months and you need to just talk to someone in the meantime. And let's be honest, moms can be stressed for a variety of reasons.
Yeah.
It doesn't have to be a chronic condition. It doesn't have to be PMDD. And sometimes you just need someone who will get you through that crisis moment. And that could just be your toddler is just very small and doesn't understand boundaries yet. So what I will do for the moms I work with is to make sure they know how to take care of themselves. Because also we are not taught that as women a lot. We are generally still the caretakers and forget ourselves.
Yeah. You brought up stress. We haven't talked about that yet at all. I know from all of my work and from all the people that, I've spoken to over the years, stress is the biggest dysregulator in our bodies. Hormonal dysregulator, inflammation dysregulator, health dysregulator. So how does stress play a role in the conversation around PMDD?
We see from personal experience or in all the support groups that stress makes it worse.
Yes.
Like you can have found treatment that works, sometimes you don't, but then you get into a very stressful period because something at the job it doesn't even have to be related to your PMDD. It can be a stressful event that anybody in life could experience, and we will see PMDD get worse.
Yeah.
Also, partially because people tend to have less resilience. They might not be able to use their coping mechanisms as well, because you can establish all these things. You can know how to talk to your partner in your bad days, but then all of a sudden something at work is stressing you out, and it's like you're always at a filled glass, and then you pour something else in and it flows over.
Yeah.
And I think for people with PMDD, the glass is always more full.
Interesting. So the tip over is going to be much, much shorter.
Yeah.
So this really is such an important topic. A lot of, confusion or lack of knowledge and information. What is sort of, as we come to the end of our conversation, and before I ask you, the last question I end every podcast with, what is it that you really think that women should know about PMDD? What is the thing that you really think that is missing in the conversation around PMDD?
I think what's missing is the awareness. So I always say, if your cycle is impacting your quality of life, then it's not normal, and you shouldn't take the normal is like, oh, this is just belongs to being a woman. Like,
Yeah.
don't take that for an answer. If you're feeling not okay because you have pain around your menstruation, because you have severe mood swings around your menstruation, go and get help. You don't have to suffer through this.
Yeah. Yeah. I think it's so important. And we do normalize it. And for some women, they don't even know there's a problem because this is just their normal. And so they think this is just, standard PMS for me. And this just is what it is.
And that's why I think it's so important that you're also facilitating these conversations around women's health, because we're also not talking about it enough, because there's still stigma and shame around all those topics. So I think it's great that you're opening up these conversations.
Yeah, thank you. And thank you for you really doing this work also in this area, because it's an area that is not discussed at all. So as we come to the end of our podcast, I end my podcast with the question I ask all my guests. This podcast is things I want my daughters to know. What do you want your daughters, nieces, goddaughters, that sort of next generation of girls, what do you want them to know?
What I like, I would tell this to every girl. I will probably tell this to my son. Get to know your cycle. Like, start early, start tracking. It's not a bad thing. It's nothing to be ashamed of. And start demedicalizing it, because our biology lessons are so much focused on reproduction. But charting your cycle and understanding your cycle can be fun. It doesn't have to be medical. It's knowledge about yourself, and that knowledge is power.
Yeah, I couldn't agree more. A friend of mine recently, her teen daughter just started her menstrual cycle. She just had her first period. And she messaged me and she said, what's the one thing I need to be paying attention to now that my daughter has started a period? And I said, the one thing she has to do is start tracking. And I think if you start doing that from day one, I know I tell my daughters they should be tracking their, you mark on the calendar with a red circle, just so you know when it is at the very minimum. So you start having some map and planning of when your bleed is going to be. But tracking, I think if you do it early on, it just becomes part of your, what you do. And that connection that it creates with your body is profound and is going to serve you well throughout your whole life. So I think that,
and I think everyone should have that, because it's such a wealth of your knowledge to have.
Yeah, I think that's a really important piece of advice, that every female should be tracking her cycle from as early on as possible. And as you said, there are different ways to do it, and different apps and different journals and all these different things. So find a thing that works for you. Claudia, thank you for this conversation. This has been really, really fantastic. Where can people find you if they want to know more about your work, supporting mums with PMDD? They want to know, they want to follow you and learn from you. Where can people find you?
They can follow me on Instagram. This is where I talk about a lot of stuff, but I also have a Facebook group just for moms, the Mom Village, because I want women just like you to connect, to talk about stuff, to have a place where they can safely vent or ask for help or ask the questions that really matter to them.
Yeah, amazing. Okay, so everyone check out Claudia either on Instagram or her Mum Village Facebook group. Thank you so much for this conversation. Really important, really profound, really something that every woman needs to be aware about. Thank you all for listening, and I look forward to seeing you at the next episode of Things I Want My Daughters to Know podcast. Have a great day.